there's a pocket of 5 millimeters or more after scaling and root planing, that is where it will go in the surface, not the tooth. So if it's 30 mesio and there's a 5 millimeter pocket, you've done your scaling and root planing, it came back for reevaluation, the pocket has maybe gotten to like a, I'm sorry, it was a 6, now it's a 5, and you feel like it could be a little bit more, that's a good indication to use Arestin in that surface, 30 mesio. Not 30 mesio and then slide it into the buccal. No, because this one cartridge is for one surface. And also this one cartridge can run in private practice anywhere from $40 to $80. I work in the city, so this is like 60 to 80. If you're in Connecticut, it's like 40 to 60. So you would not propose a treatment plan of 12 Arestins on one patient. That's a perio case. You're not doing it. 4, maybe 3, but 12?
No.
Because it comes in 12. It comes in a case of 12. You're using the whole thing. That's like thousands of dollars worth of treatment for this patient. This is used after scaling and root planing, and when I say after, I mean after they've come back for a reevaluation. So you've done your treatment, scaling and root planing. Like I say, you've done the upper right quadrant. They come back for the next visit, it's time to do the lower right quadrant. You would recheck the upper right quadrant. If all your 6s have turned into 5s, or if there's one stubborn 6, feel free to use Arestin in that area. This has to be treatment planned, of course, and in the clinic it has to be discussed with the dentist in conjunction with what your treatment plan, and then she'll let you know if it's okay to go ahead and do it. After you've done your treatment and you've placed your Arestin, the patient is to come back in about 6 weeks so you can check. You don't want to just place Arestin and let the patient go, because then what could happen is in 6 months you did all that hard work and you don't know what it is to be or what happened. What did they do? Did they not do anything? Did they even leave it?
Yeah.
Arestin works for about 14 days in the area that you've placed it in. So you do have to have your patients not use any interdental aids for 2 weeks. So they can't use floss, water pick. They can brush your teeth, but no soft picks, just in that area where Arestin was placed. Everything else is fine. I also have so these are cartridges, these are test cartridges. Some of them have black ink in it, some of them don't have anything but air, but you'll be able to feel it. Test cartridges on how to put it together. This is also another demo. You don't want to have this, you know what you're using it for, but you don't know how to put it together, and your patient is right there. You don't want that to be a situation. So I have 2 cartridges and 2 syringes and some cartridges, so you guys can come up 2 at a time, and I'll show you how to put it together. There is a little indicator on the cartridge that lines up with a slot on the syringe. You hear that click. It was kind of low, sorry. You hear the click. You take off your tip. You identify your tooth. You still use your fulcrum. You place it into the pocket directly, subgingival, into the pocket. Place it in. Sometimes, so it comes out in a yellow powder form, and once it's in the pocket, it turns into like a gel type. What can happen is if you're not deep into the tissue, if you don't go farther down, it's gonna sit on top, so you can take your probe or your explorer and gently just press it down into the pocket. But if you get down deep enough, you won't have to do that, okay? To disassemble the cartridge, you pull back on the handle and pull out, all right? All right, guys, come on.